So I'm indeed very much happy today to moderate this session on a very special topic and indeed a topic which needs much more awareness, that is assault on resident doctors. Because I myself, with few of my friends in the BMCRI, we work really hard to how best can this assault on doctors be prevented and what are the measures that we can take. And I would like to state one sentence which was stated around 135 years ago in a US journal, which states that no physician, however careful he can be, in whichever part of the day or whichever time, he is not, he cannot be, or what, he cannot undergo any assault in terms of verbal or physical or mental abuse. So this statement where health professionals cannot take any sort of verbal abuse or any sort of assault from the other side apart from the doctors, which was stated around 135 years ago in US, which makes its prime importance why this is so much important even today's era. So we'll quickly move towards Dr. Surya and Dr. Dheemanth, listen to them what they're gonna tell, and let us discuss exactly accordingly. Dr. Surya, please go ahead.
Yes, thank you, Namratha ma'am and Kishan sir, for giving me this wonderful opportunity. So I will try to speak from the patient perspective of view. Patient comes to a hospital when they face a lot of pain in their health, and they come with a lot of hopes so that the pain is reduced. But there are some experiences which happen in the hospital which increases their pain. So I would like to throw light upon it. So as soon as a patient comes, when they come to a casualty, right from the way they are received from the ambulance until how fast a doctor approaches a patient to look after the patient and treat the patient. So when this aspect is seen in reality, many of the times as doctors, we know that certain conditions are very trivial. They might not be an emergency to be attended soon. We know what is triaging. But from the patient's perspective of view, to them, the pain, the abrasion, it can be a pain abdomen for a small child. It can be in the middle of the night. For them, that is the most important thing. But for us in casualty, we might have so many other cases which is not seen from their perspective. So when they enter the casualty, they need to be wanting to get the attention first, which they might not get. This might make the patients aggressive. Secondly, there might be a lot of communication gap. Whenever we see the patient, we have to, there are communication gaps like we might not explain to them regarding the facilities available in our hospital, regarding the need for referral to higher center, regarding the few investigations that they might have to get it done from outside. These things might not be told. We might just take explain to them regarding all the facilities available in our setup and all the regarding the prognosis, what to expect, etc. And especially when the patient is admitted in the ICU, we make sure that a lot of patient attenders are not allowed inside all the time. So it so happens that the doctor might be putting a lot of efforts in saving the patient's life, but if he fails in the communicating the same to the patient regarding the daily progress, there can be a hell lot of difference when if something goes wrong, you treat the patient so well for a week and suddenly the patient dies and all your efforts are not communicated to the patient attender, suddenly there will be a ruckus created that the doctor hasn't done anything. When it comes to taking consents, sometimes we have a very huge written consent which they are made to sign, and we sometimes do not even explain completely to them regarding the risks, regarding the operations and procedures that are being done. It could be a simple anaphylactic reaction which also need to be explained to the patient. They might not understand the minor things that usually happen sometimes. For them it might be new, but it's very common for us. This is because they have a lot of low health literacy. They might not know regarding all the things that are happening in the healthcare system, be it in the shortage of the healthcare workers or shortage of the other support staff. Many times it happens that we ask them to get an investigation done. Sometimes they have to roam around. They do not know the place. They are new to the place. They'll have left their homes from villages. They'll have come to a bigger city. They will not know anyone. If we do not explain to them regarding how they have to get an investigation done, where they have to go, whose help they have to take. If you just write a prescription and ask them to get this done by the next day, they might not know. So many times it has happened that the patient attenders have just kept the blood filled vacutainer with them till the next day, thinking that somebody might come and take it to the lab. So when there is delay in investigations and all, and if it affects the patient's health care, the care that we provide, again, the patient here surely will not, show their anger that time. But if at all the patient dies, they are going to put out all their anger right from the problems that they faced in the casualty, right from the way the group Ds, the nursing staff treated them, how they responded, how the security staff spoke to them, how they were asked to go out of the ward. These are all the small things that has to be taken care of, because they are new to the hospital. They come with lot of expectations, thinking that this is a bigger city. The doctors here are going to treat us. All the facilities are available here, and we will not have to roam around, and everything will be given to us under one roof, which is not the actual reality. But this is not known to them. For us, it might be the 100th patient that we are seeing that day in the end of the day. But for them, it is just one patient that they are coming to the hospital with lot of hopes. And they expect you to see the patient very well, even though you are tired. This is the expectation that any patient would have. This is the expectation that even I would have if I would take my family member to a hospital. And there are a lot of changes when it comes to reality, that they expect. Many times the patients come to government hospital with expectation that everything is for free. But we know that there are some certain government charges that are going to be paid. So all these have to be well communicated to the patient, and they need to know what are the things that they can avail, and what are their rights also. So I'm actually here not trying to justify why they attack, but these are the few things that by making very small changes, by narrowing down the gap between the patients and the doctors, we can try to prevent such attacks. Okay, I'm done with my point.
Yeah, very well executed, Surya. Yeah, you spoke very aptly. That was with a point of view, you being a resident doctor in a government hospital point of view. Very rightly said. So whatever the scenarios, whatever the currently happening, whatever the situation is happening, you explained it very clearly. But it was more of a government hospital point of view. But I would like to add, even
Yes.
assaults happen in corporate hospital also. So later I'll be telling my experience, because not only the patient, you spoke about how the patient's expectations will be for in a government hospital. So even if the
Yes.
100% facilities are given, the same sort of assaults happen in a corporate hospital. The reasons being different from the patient's perspective also. We'll speak about it later. Now we'll go to Dr. Dheemanth, who's going to speak more from the doctor's perspective view. Over to you, Dheemanth.
Thank you, Namratha ma'am. Thank you, Kishan sir, for this golden opportunity. And today in this session, I will be speaking regarding this topic, assault on doctors, attenders attack versus doctors defense. And I will be talking about this doctors defense perspective and point of view. So first of all, I would like to take this opportunity in this session to say that people say that the doctors are gods and doctors can do anything to save a patient's life. And they see us equivalent to a god. But from my point of view and from most of my colleagues' point of view, we don't want that tagline or label as a doctor, as a god for these doctors. Because doctors are making a doctorate is just a profession, wherein just like other profession, like as lawyers, teachers, or police people, we will be just delivering our services to the best of our knowledge, what we have acquired in our academic sessions and in our practice. So this I would like to make affirmative in this session. So coming to discussing the doctor's defense point of view, I need to divide my discussion in these following ways. That is the preventive strategies, how these kind of assaults can be prevented. I just listened to the argument of my colleague, Dr. Surya sir. He well said about the lacunae which are present in our system between the doctors and the patient and what misunderstanding could lead to this. But according to this, the preventive aspects can also be taken care of. whether it is in government setup, whether it is in private setup. And along with that, what are the legal strategies we as a doctors or the government should take up or the policy makers should take up to prevent these kind of assaults and give a very safe environment for doctors to deliver their duty to the best of their ability. So coming to this, few of the reasons why these assaults are getting more and more these days is, let me narrow down from the top to bottom perspective. From the government perspective or from the top perspective, which I want to speak, the meager healthcare budget. As we all know that the healthcare budget or the GDP, the percentage of GDP what the government is allocating for the healthcare services is around 1%, which is a very sad news. And in a global average, the GDP global average, which has been contributed for the healthcare services all over the world is approximately 5.4%, which gets this into this situation, allocating only this meager budget. And the other thing is the overcrowding and long waiting hours, especially in government hospitals. So this leads kind of frustrates and distresses the patient, making them to lose the patients of theirs because the patient would have come with some of the grievances or some of the problems which the doctor want to address that problem. So I would like to substantiate this point with some of the statistics and figures. So we all know that in India, in a most populous country in the world like India, the doctor-patient ratio is very, very less. So the WHO guideline says that the doctor-patient ratio in a country or in any country in the world has to be 1:1,000. That is one doctor per 1,000 population is a standard WHO guidelines. But very sadly, in our country, the statistics says that there are almost 6 lakh deficiencies of doctors in our country. What is the present count? What we have? We need still more 6 lakh doctors to cater the populous country like India. So, and the nurse-patient ratio, because the healthcare system involves the nurses, paramedics, doctors, and all the cadres of people who are delivering the healthcare system. So in this, it is the statistics says that only one nurse is present for 483 population count in our country, which says that there are 2 million deficiencies of nurses in our country. And this, looking at all these figures, we can figure out that in our country, there is probably two times the doctors we need from the current populous country, and we need 3 times more nurses to cater out the population of our country. And more than that, 3 times paramedics are necessary to cater the population of our country, that is around 1.3 billion. Which our country stands for. And according to Indian Medical Association, which is a premier pressure group operating in our country, 75% of the doctors in their whole career timeline would have faced any threat or any abuse or any assault from the doctor, which is a very sad thing in our country. So what all this is leading, because the trust deficit between the patient and the doctors. Yes, there is a trust deficit because I could say that media sensationalization of certain aspects. For example, the media coverage which happened recently, probably 2 years back in a government hospital in Karnataka, wherein the patient was not able to carry it in the stretcher and patient attendants were carrying the patient. So this was sensationalized. I just want to appeal to the media people that we have to see the ground reality. We have to see what has happened. Whether just seeing the situation and sensationalizing the lacunae which was present in that hospital or doctors, we need to see that particular situation, what exactly is there. And the second point is the general awareness or the general perspective of the public that doctors are the looters. They write unnecessary investigation, they loot money with investigation, they loot money with the prescription charges or hospital bills and whatnot. So this point of perspective is there in the public's mind, which is leading to all this. So coming to certain legal bills or legal acts which are there in present and which was drafted in the recent past, which was protecting us, not exactly protecting us, which was supposed to protect us. So coming to the first one, the Medical Protection Act. So this Medical Protection Act was passed in the 19 legislature all over our country, including the West Bengal state, because I'm just addressing this West Bengal state specially because there was an assault. There was a grievous assault which has happened in the recent past. And this features of this Medical Protection Act is if a doctor is abused or assault has been done on the doctor, which leads that the perpetrator will be imprisoned up to 3 years, and 50,000 fine can be imposed on him for the damage of the property and for causing violence to the doctors. But I would like to say a lacunae which is present in this Medical Protection Act. So the lacunae which is present in this Medical Protection Act is that from this Medical Protection Act, this features of this Medical Protection Act is not present in IPC sections or CRPC sections where the laws will operate in our country. So this makes the victims, that is doctors, to approach the police or any legal system because there are no features of this act present in the present in the IPC and CRPC. And coming to the second, the bill which was drafted in the recent past in the year 2021, that is the Prevention and Prohibition of Violence Against Doctors and Damage to the Property, which was proposed in 2021 and which was rolled out. But sadly, the bill was taken back. The drafted bill was taken back. This is because the Ministry of Health Affairs put forward the bill, put forward the draft of the bill to pass in the legislature. But sadly, the Ministry of Health, the Ministry of Home Affairs, Ministry of Home Affairs took back this bill saying that there is no need for a separate law for medical professionals or doctors because the IPC or CRPC will take care of any grievances which is got by the doctors. So this was a very sad part, and this is why many of the pressure groups are fighting till date to get this draft bill passed into an actual bill. So this is a kind of bills which are supposed to protect us. So this Medical Protection Act, what I was telling about, this is not actually a strong and powerful act because it has failed in protecting the doctors against the assault or against violence or against any abuses or damages to the property, just because it is not, the features of it is not present in IPC or CRPC, weakening the bill. So we need to leverage this opportunity to make this bill stronger. And coming to the way forward, the first way forward which I would like to say is, as I discussed regarding the prohibition and prevention of violence against doctors and damages to the property bill, we need a central law. We need a comprehensive law to address the doctor grievances, the assaults or abuses which has taken place. Because as I said, the Department of Health is in the state list of constitution. It is not in the union list. It is not in the concurrent list. It is in the state list, which is making the central government unable to pass any unilateral decisions or unilateral bills in the protection of doctors. So first thing which we have to do at the policy level is we need to bring this health department in the concurrent list, which involves both central government and the state government to take decisions or pass bills regarding the same. And the second thing is the CCTV cameras has to be situated right from the PHC level, because I could say very confidently that in most of the PHCs in our state, Karnataka, for example, there are no CCTV cameras to protect the doctors or to protect the working environment. And there are no proper security guards also. So I would like to say that at least we can hire a home guard, if not a police person. We can hire a home guard at the PHC level, because at the Taluk hospital level, at the tertiary level, there is a police outpost, but sadly, the police people will not be present over there, in my experience, to be saying. So at least a home guard should be hired right from the PHC level till the tertiary center level. Okay. So these are two way forwards. And coming to that, we need to bring awareness in the public. So awareness in the public regarding what, as I mentioned before, they see doctors as a looters. So we need to bring awareness in the public saying that how exactly we work. If we write any investigation, we need to substantiate why exactly we are writing this investigation. Or if a corporate hospital is making such kind of bills, we need to substantiate why all these bills are being done. So an elaborate bill structure on elaborate awareness has to be brought. And the second awareness part which has to be brought in public is, as I said in my opening statement, that we have to bring an awareness in the public right from the primary level that doctors are not gods. They just can't do whatever best they can do with their experience, with their skills and with their academic knowledge. So this has to be brought down in the public's mind, because as Dr. Surya sir also mentioned, that the patients come with a lot of expectation to a hospital or towards a doctor. Because this is happening because there is lack of awareness. I would truly appreciate that they come with a lot of trust on doctors, but I would like to also say that they have to know the limitations of working power of a doctor or what he can skillfully do to a patient. So this has to be gotten up. And I also try to see a way forward that from the pressure groups, that is the Indian Medical Association, as I mentioned, the premier pressure group which is operating in our country. Along with that, the Resident Doctors Association of various medical colleges, and the Indian Resident Doctors Association. For example, I would like to quote FODA. So these kind of pressure groups like IMA and this Resident Doctors Association has to actively involve in policy making affairs at the government level, so that we can address what and all lacunae or what and all grievances we have, and we can have an opinion while designing the policy. So I would like to say this has to be actively involved more. And I would like to also say that the hospitals have to set up a standard operating procedures, SOPs, like any other department is concerned, because we can see in many corporate hospitals all over the world that the purple code is used by the hospitals to disseminate the information to the whole hospital through the public addressing system of the hospital, saying that there is some violence going on, or there is some abuse going on, or there is some mob lynching, or the mob has attacked the hospital. So this has to be disseminated. And during this time, the most important thing is we need to show the unity. Our fraternity has to show the unity in the hospital against such kind of mobs. Okay, so once that purple code has been activated, the staff, except OT staff and except ICU staff, all staff should come to the place where the abuse or the assault is going on. We need to form a human chain around our doctors, the victim doctors on whom the assault is going on, and we need to de-escalate the situation. And I would also like to say that in these kind of situation, the role of professors or the role of senior consultants is very crucial. Because the sad part is these days when assault happens, as we have seen in the news or any other media, by information, the senior consultants or professors would not involve in these kind of activities, or they would support our strike, the residents or intern strike, very unofficially rather than officially. So that senior consultant or professor has to come on the spot. He has to try to deal in a diplomatic way, de-escalate the situation, and try to, kind of prevent that assault or violence which is going on doctors. So this unity has to be shown up. And I would like to quote two beautiful examples comparing the Western countries to Indian countries. When Cristiano Ronaldo's baby died, he had tweeted saying that in spite of best efforts of the doctors, my baby could not be saved. I would like to say sorry for my family and for the public. So this is the mentality. This is the kind of awareness. This is the epitome of awareness which has to be got in each and everyone's mind in our public of our country, India, as well as any other places concerned. And also the sad part is the political leaders or the netas, they won't defend these kind of attacks. Just we can see in the Kerala incident, which happened recently, the health minister gave a media statement saying that the intern was not capable enough to manage the case, which is a very sad part. Because they have to take a stand, they have to support us, and they have to be a backbone, because the political will is very much important in bringing these kind of changes. And I would like to also remember an incident which happened in Madhya Pradesh, that because of the abuse from a neta or a politician, the doctor ended up resigning, a senior consultant ended up resigning. So this causes the going down or decreasing morale among our profession and cadres, which we are giving our best to save our lives, which we could recall in the situations of COVID. So these are a few of the way forwards which I would like to quote in the defense of doctors, and how we can overall the whole system of this medical profession, preventing our doctors and our healthcare workers from the assault from the public. Thank you. Thank you, madam.
Yeah, very well said and very comprehensively delivered. So overall aspect, the overall actually what is going on with from the doctor's perspective point. Yeah, I would like to add to whatever you said. Recent days, yeah, it's the assault on doctors, in spite of the awareness, has increased. If I'm not wrong, during the time of COVID, the court delivered a statement telling the patient's relationship with respect to the doctor is more kind of a consumer. So we are liable for whatever they are paying. So they expect we owe a service to them because they are giving whatever the money they are giving. So it has become a more of a buyer-seller kind of relationship, no more a service-providing relationship after this statement, which made a more damaging statement on our profession also. So after this kind of, the assaults have increased in number also. So very well said, Dheemanth. So I have a few queries. I'll start with Dheemanth only. So you said everything with respect to the doctors, supporting the doctors. Do you mean there is no point, nowhere the mistakes happen from our side. Negligence, what I'm speaking, medical negligence.
Yeah, ma'am. Probably in many of the situation, medical negligence could happen. And some mistakes or gross mistakes, I would like to say, in very particular way, gross mistakes could happen and would have happened in past also, or in future also it may happen. But I would like to say that the medical negligence which is put upon the doctors, in most of the times it is malicious cases. A malicious prosecution is done on the doctors, I would like to say, because just because the patient has died because of something else, the malicious prosecution on doctors saying that medical negligence has happened, this is how they file the case. And I would like to recall a few of the situations wherein, when I was studying in my medical college, near our medical college, there was a PHC, and the medical officer of that PHC was filed FIR stating that it was a medical negligence, which was a malicious prosecution, which I would like to say. And these kind of things happen. And recently also an assault happened in to one of my friend, and wherein the patient attendants have went to file an FIR against her and the doctors, which is a very bad thing. So I would like to say that even though the negligence or gross burden happens, since we are humans, it may happen. I will bravely accept that. But still, the malicious prosecution, filing fake cases on doctors and going to the FIR level is the worst part, which I would like to say, and which is happening in most of the circumstances.
Yeah, what I would like to add is, yeah, we are leaders in treating the patient. Of course, I agree with that. But of course, when it comes to patient's treatment and his outcome, it is a teamwork. We, along with the resident doctors, junior doctors, nursing staff, group D workers, whole hospital, as a teamwork, we will be dealing with the patient. But the amount of burden, the burden of the imposition, which is which is made to pay by from us, is majority is on the doctors, which is not right. That is what I would like to tell, because since it is a teamwork, but only the FIR will be filed against, not the huge amount of penalty which is made to be paid. It is on the doctors, because we play the role of a face of the situation. We play the role of a leader when it comes to treating with the patient. That is the how they deal with the situation of putting an imposition on the doctors on a major huge amount is not good. So that is one point where it has to be taken care of. And there comes the importance of documentation. So that is where we become safe also. Like, that is one way we can prevent the mishappenings in future when it comes to the negligence part. Even if we have not done the documentation, where it becomes the most important part, we can avoid pretty good amount of violence on doctors also.
Yes, ma'am. Absolutely.
Next, I would like to ask Surya, you were telling exactly about the patient and also the patients not being attended in the casualty when they come to in a very grievous situation, in a very tensionful situation. So you mean to say
Yes.
it is basically not attended, patients being not attended. So, like, the casualty will be flooded with patients, and at the time there will be one more patient coming with any other emergency situation. So when that patient is not being attended, then arises the violence of the doctors. So basically, how would you like to deal with this? What solution would you like to give for this?
Ma'am, I would like to talk upon the reality that each one of us would have experienced during our internship. For example, in a casualty, there will be multiple interns belonging to different departments, or multiple PGs belonging to different departments, medical, surgery, ortho, so on and so forth. So we all will be sitting in one doctor's area, and as soon as a head injury patient is railed into the casualty, so we know that the medicine intern knows, okay, this is a head injury case, I have nothing to do with it. But maybe the surgery intern is suturing another head injury case or is handling another case. So when the patient attenders bring such cases, if he is not attended immediately, the first thing he sees is those 4 or 5 doctors belonging to the other department might be simply sitting or doing some other case sheet filling works or anything. We as doctors know it's not our department case, so we keep quiet. But the patients think that these doctors are not attending, they are not doing any other work. Here, maybe the CMOs will play a major role, but again, there will only be one CMO and they might be attending another patient. So at that point of time, at least, maybe if one of the interns from any department come and just talk to the patient and
So
explain to
basically,
them
you mean
that,
group
okay,
work.
your group work,
Basically, you
there
work
needs to
in
be
group
unity.
work
It
with
shouldn't be like,
unity whenever there is, yeah.
yes,
So,
whenever the particular intern is accommodated in attending another patient, it should be that we should not say that this is not our case, we will not see it. We should go, we have to at least see the initial part and try to convince them that you'll be attended. And if there is any emergency things that needs to be done, like maybe if the patient is collapsed, providing CPR or anything, that
yeah,
should be
got
done,
it.
and we should not get divided by the departments in which we are working.
Yeah, that is what, as Dheemanth said, not only when the assault is happening, we should have an alarm system. Even when the casualty is flooded with patient, mass casualty, then alarming system should be there with respect to the doctor's arrival to the casualty. Maybe doctors who are on duty and off duty also. What you mean to say?
Just as important as code blue, I mean code
Yeah,
purple that Dheemanth had told, even code blue is also very important when it comes to attending the patient.
okay. So, Dheemanth, as you said, like probably I'm very sure you'll also be. My next question is to Dheemanth.
Yes, ma'am.
Probably, I'm very sure even you will be aware of that. Supreme Court made a statement. Doctor's profession is just, you yourself said in the initial part of your discussion, as we are not gods, we are just a professionals. So,
Absolutely.
how do you justify your statement that, as you said, we should be given the legal system, so and so support, a so and so act should be there, which is not there for professions? Because this was the statement made by the Supreme Court. Because we cannot give any other what to tell any other supporting systems, because medical professional is also similar to other professions.
Yes, ma'am. That's a very wonderful question, actually, and that's also a very kind of critically analyzed to be question, which I would like to say. And one part I would like to say is Supreme Court should, like as you asked me a question saying that why this the special acts or special protection has to be given for the doctors. The first point is I would like to say that this special act or special protection which is supposed to be given by doctors is already it is very less. I would like to say, because I just want to give you an example wherein if a police inspector or take a police constable who is on uniform, if someone makes an assault or say someone tries to attempt an assault on a police officer, means right away they take them to the custody and they'll put behind the bars in the police custody. Oh, so which is a kind of default protection or default immune system what they have got. So this is the first point which I would like to say, saying that doctors have not given that natural immunity to protect ourselves from the public or these kind of assaults, which I would like to say. And the second thing is, unlike other professions, say that, yeah, of course, unlike other professions, will also deal with some of the vital things of people's life. But in our profession, especially in our healthcare profession, we deal with emotions. We deal with outbursts of emotion. We deal with extremes of emotion from where the patient will come or patient attenders will be going through. So because of this, these kind of assaults or these kind of violence or these kind of, I would like to say, natural outbursts on the person who is a leader in front of them or who is a responsible person for treating that particular patient, on them, this will be very much naturally coming from the patient attenders or patient side. So this is why I would like to say, or this is why I would like to urge to the policymakers or to the judiciary or to the legislative system that the Special Protection Act for the doctors has to be given more than any other cadres, which I would like to say.
Basically, our profession is directly dealing, we are amidst the people, we are directly dealing with the society, where be it medically being harmed or the mentally being harmed or physically being harmed, we are at the
We are
stake
dealing
of
with
it. Because
lives.
we are in the
Yes,
forefront.
ma'am.
We are dealing with the life of ourselves also and dealing with the lives of the patients also.
Yes,
This
ma'am.
is what you mean to say. Fine.
Yes, ma'am.
And Surya, like you were speaking about the communication skills. So what best can, that this lack of communication skills is what you meant, but see, communication skills now though that is need UG, even the outside state residents will be taking in different states when it comes to Karnataka people going to Maharashtra, and there is a language barrier. So would you like to add any solution for this to build? Because recently the incident which happened in Tumkur was mainly because of the language barrier. Because you become close to the patient attenders, you gain the confidence of the patients only with from the language you speak and the way the body language with which you speak and with the confidence which you speak. So if the patient attender sees to it that there is some mishappening, obviously they feel that this doctor is not capable enough to handle my patient. So how do you like to tackle this? What is your solution for this?
Ma'am, yes, ma'am. Usually when we go out for any other state for a post-graduation or something, we have to put our honest effort in trying to learn that language. But however, it takes some time. We need to at least try to, learn the first few important languages. For example, there is a book by White Army, which helps us, the language of the healthcare, which helps us to learn. At least initially, we have to try to learn the few things so that which will be helpful in explaining to the patient. Or we can also take help of the locals. There will surely be either any one patient attender who will understand maybe English or Hindi, or we can even take the help of our local friends, the other PGs who are working there, to help in communicating, especially when it comes to taking any high risk consent, or the patient needs referral, or you have to explain to them regarding the very bad prognosis. So at least in such situation, and most of the time, ma'am, whichever language we speak, even the facial expression, our body language also plays a lot of importance when we are explaining. We can even tell, the way we break the bad news, the way we tell something which is serious also, even our body language can play a lot of role when it comes to communication. So I feel that
very true.
along with trying to learning the language, we should also try to take the help of our friends who will be there from the local place.
Yeah, what I would like to add is, of course, until you finish your final year MBBS, we are not allowed to practice. We are not allowed to deal with the patients. No? So we can inculcate in the curriculum, whichever state we are in, half an hour daily of language training programs to the outsiders, to the people. Yeah, that would help them because when they directly come into internship, they can directly deal with the patients in a better way. So language training programs in respective colleges, this doesn't require any policy making, anything of the sort. The respective administrators of the college can take a lead in this. Also plays an important role in reducing the violence because communication is a key important thing which plays here, is what I feel. To both of them, any one of you can take this. All of you are speaking regarding 1% of the GDP is provided to the healthcare system, all those things. Okay. Yeah, where the facilities are not available regarding awareness. So, regarding awareness, how do you like to spread the awareness? Like assault should not be happening against the doctors, or how exactly, what exactly the awareness would you like to spread among the society? One thing you said, God, the doctors are not gods. Everything is not under our control. And at the same time, I would also like to add that, like the government hospital, they should be knowing that all the facilities are not available in the government hospital. Take it as a Hassan only, for example. So it is a district hospital that is the epicenter for around the whole entire Hassan district. But if a patient comes in an MI, acute coronary syndrome, where is the facility to do angioplasty within 30 minutes or within 90 minutes? The facility, they have to come to Bangalore or Mysore only, which takes around 2.5 2 hours. So government should think about this because the guidelines now to save a patient from acute coronary syndrome, the primary angioplasty has to be done. But for the patient, for the angioplasty to be done, they should be ended up coming to Mysore or Bangalore. So which is a primary facility which needs to be provided. So government should be focusing more on this. So awareness should be created among the patients Like all these facilities, even though the government hospital is a big hospital, these facilities are not available at this institute. So it creates an impression that this patient cannot be treated here. We cannot demand for more treatment from this hospital. So this kind of both of you spoke about the creating awareness, but creating awareness with respect to the non-availability of the facilities in so and so hospitals is also important when it comes to awareness also. So any one of you can take the question. With respect to the social media, the role of social media. See, now that the social media has become very rampant, that's why, but maybe we are able to speak about the awareness among doctors because still the awareness is not enough as the events are happening, be it a very small incident which happen outside, it becomes very viral on the social media. But what happens to the, what about the assault on the doctors? When it comes to the assault on the doctors, it is very mere projection. So what is your take on this? What is your opinion on this when it comes to the social media role?
Yes, ma'am. I would like to take up this question. As we all know that we are a small fraternity when compared to other fraternities like lawyer fraternity, let's consider, or a military fraternity, let's consider, or any police fraternity. We are a small population of fraternity. So because of which we just go unnoticed among the public when we have some assaults which has happened, when any grievance from the doctors which had happened. We could very strongly see the situation which happened very recent in the very recent past, wherein the pan-India strike was going on regarding getting this NEET PG counseling done very sooner. But in Delhi, it went unnoticed, which I would like to say, when compared to other small incidents which would happen and which would go viral in the social media. So I would like to say that one thing, the doctor-patient trust has to be got in the public, because public usually sees doctors as kind of looters or kind of, they will do a lot of money with all these things, and they just, many of them consider us as like leeches, okay, which is, to be very honest. So because of these things are going unnoticed, or people are not caring about us so much, one thing. And the second thing is the health leaders in our community. For example, a doctor who becomes a medical education minister, or a doctor who becomes a principal secretary for the Department of Medical Education or Health or Family Welfare, or the presidents of the pressure groups like Resident Doctors Association or Indian Medical Association. These leaders, these faces for our fraternity to the public, towards the public, has to take the initiative to spread the awareness. What are the problems which we are facing, and if we have faced any problem, what limelight, political limelight it has to get, the media limelight it has to get, or the judiciary limelight which it has to get. This has to be taken care of from these leaders, which I would like to quote, which I would like to opine.
You said rightly that we are professionals who are in very less number, but we are the professionals. We are the most powerful professional also, who can bring a change. So just being in a small number doesn't mean that it can be neglected, but I would still rather give a call for the social media or the television media people to, if they are projecting more on doctors with respect to the assault, it definitely brings a change, which we are lacking in. As you said, the political leaders, the doctors being the political leaders or in the administrative field, they'll have to take a stand on this, and we should stand united. So that is what
I want to add up one more point, that there are many doctors who are leading YouTubers, which we could see recently, with a lot of fan following or with a lot of subscribers for them. And those people has to take the initiative as well, because they will be influencing the public regarding what perspective has to be there on the doctor, or what are the difficulties which they are facing.
Yeah, very true.
Ma'am, even I have a point to make. Ma'am,
yes,
especially we know that doctors working in PHC have a very wonderful bond with the local public, be it the panchayat members or be it the local population. They also know that, for example, a PHC in Hassan, the doctor working there will know the capabilities of the taluk hospital or the district hospital present in the district. So they should also actively involve all the panchayat leaders or all the political people and explain to them regarding the facilities available in the district. For example, if you take Hassan district as an example, when the MLA visits the hospital, the the medical superintendent or the directors can proactively involve the politician also and tell that these are the cases which we are referring, which were supposed to be an emergency cases attended here, but we are referring due to so and so lack of facilities provided. So by pressurizing the local MLA, we can ask them to get the facilities, to open a super specialty hospital. For example, now in Hassan it is happening. So might be in 1 or 2 years, we may not refer any case to Bangalore. So that's a wonderful development. These things usually take time, but if we try to involve the politicians actively and also bring it to the notice of the public media, maybe like for example, Hassan winning Kaya Kalpa was being bought and put in the newspaper. Same way, such and such facilities are still not available and still so much developments can be done. Being put up in a media can also help in public raising their voices against such issues
Yeah,
and getting such facilities immediately done.
yeah, rightly said. Involving the local leaders with respect to any point, creating awareness for the assault against the doctors or anything, and it will surely help. So it was a very good discussion. We spoke the causes of the assault on doctors. There are many causes. We can start from the local factors, hospital factors, policy factors, professional factors, and social factors. We covered it very much in short and also in detail also. In fact, so I would like to tell, like as I said earlier, the number of the assaults which are happening, yes, of course, it is more in the government hospitals and more with the resident doctors also, because we being the first contact with the patients. So, and that is why our senior professors, be it the consultants are not much into this violence against the doctors because they become the third or the fourth contact with respect to the patient. So when we are in casualty or in the emergency department where the most of the assaults happen, this is the place where the patient attendance course will be in the aggressive behavior or aggressive state of mind. So that this is the situation where we'll have to deal with tackling the patient attenders. This is where we have to learn with respect to tackling the patient attenders. That is one point. And also, I would like to tell this is with respect. This is also the ratio. The assault on doctors might be less in the private hospital because the assault which happens in the private hospital or the corporate hospital it will be with respect to the bill financial issues. Whereas in the government hospital, it will be with respect to the facilities issues which are given. So, but in both the situations, I'll tell you the assault happens. The verbal abuse, the mental abuse, it definitely happens. So, with the experience, what I have got is I've worked in the government setup also, and I'm working right now in the corporate setup also. So, what exactly is the common factor between them is the bossism. Bossism means what I would like to tell is you are our servant, you are here to serve us. So with whatever compromise we are at, that is not understood by the other party, the other side of the people. So when they realize the situation which we are in, of course, this violence, everything comes. But this realization is a big task. Making the patient attendants realize that because of the lack of facilities or with respect to the financial issues where doctors, nothing is in the doctor's hand. Because we are just the treating workers, employees in the corporate hospitals. Everything, the administration, financial issues will be handled by the someone else. So if this realization happens, many attack on violence and doctors can be, of course, cut short. And of course, as Dheemanth said, and as we all discussed, having a strong legal act, strong legal cell, of course, this law and order and health is a state subject. We can appeal our respective government or the states to have a strong legal cell which compromises of a if suppose an assault on a doctor happens in any institution, the doctor should not be fighting it single-handedly. Immediately, the institution. This, in fact, when we were in our association, in our Karnataka Association of Resident Doctors, the president previous to me, Dr. Dayanand sir, he wanted it to implement this legal cell. He had framed all the requirements to form a legal cell, but unfortunately, in spite of our hard work, we could not do it in spite of approaching any number of authorities also. But still, our successes, the present part is doing it in the, uh, they're doing it. So having a strong legal cell, having a lawyer by its own, where the legal cell will be fighting for the doctors, portraying it, there is no mistake from the doctor's side. So, and also a strong doctor and a minister should all, everyone be involved in this legal cell. When this happens, when this act becomes very powerful, of course, the violence against doctors, of course, can be reduced because the without any important legal actions taken against the patient attendant is of no use. Because what we have observed is patients who create ruckus or create all these violence are those most of the time will have a strong political background. If you charge a file and FIR against him for the damages that have happened, we have many times seen they've been out of the cell within 24 hours. So they end up, this is what it ends up in. So strong legal cell is the need of the hour, is what my point is.